The Nigerian Centre for Disease Control has established that the new Omicron variant was present in the country as early as October, and that's weeks before it was detected in South Africa. The NCDC has been retrospectively sequencing cases of coronavirus amongst travellers to Nigeria after confirming 2 cases of the Omicron variant in people who arrived from South Africa last week.
Some in Nigeria rushed to get vaccinated on Wednesday after the country confirmed its first cases of the Omicron variant. Among those getting shots, businesswoman Chimezi Agada.
My fear is that it shouldn't circulate. It should remain only one that they discovered. So I don't want it more again.
The Nigerian Centre for Disease Control said the variant was detected in 3 persons with a history of travel to South Africa.
Please step forward.
First reported in southern Africa a week ago, Omicron has highlighted the disparity between massive vaccination programs in rich nations and sparse inoculation in the developing world. Several nations have imposed travel curbs on countries in southern Africa. But data from other countries indicates the variant was circulating before it was officially identified in southern Africa. As people were lining up for vaccines in the capital Abuja, South African President Cyril Ramaphosa was meeting his Nigerian counterpart, Muhammadu Buhari. Ramaphosa described, quote, discriminatory restrictions as unscientific and counterproductive.
This is a global pandemic, and overcoming it requires that we collaborate and work together as a collective. The resulting damage to this travel ban to the economies of the countries affected will be considerable and long-lasting.
Hong Kong and Canada have barred non-resident travellers from Nigeria. South Korea has said it detected the variant in fully vaccinated travellers who arrived from Nigeria. Work to establish if Omicron is more infectious, deadly, or evades vaccines is expected to take weeks.
Joining us now is Gabriel Oke, who's a health journalist, a researcher and health rights activist, to share some insights on the news and how Nigeria is responding to the news of the Omicron virus. He joins us now from Abuja. Thanks very much indeed for joining us, and welcome to the program.
Thank you very much for having me. Thank you.
All right, tell us about these indications that have been shared by the Nigerian authorities that the Omicron variant could have been in Nigeria long before it was detected here in South Africa.
Oh, thank you very much. In October, some media channels published that Nigeria already has Omicron in circulation. But the Nigerian Centre for Disease Control that has the mandate to declare, and after testing the samples that they get in their laboratories, did not come up with anything until today when they confirmed. And when they confirmed today, and when we asked them why didn't they confirm then, when some other media channels were talking about Omicron in Nigeria, circulating in Nigeria, so they denied the fact that Omicron is in Nigeria. And what they said is that when they checked the samples of the suspected cases, they were suspecting those cases at October. They said those cases actually were Delta variants. So officially, the samples that they detected to have Omicron were from people that came from people that had travel history from South Africa from like last week, so just today they were able to declare. But yes, as you were trying to, as you were saying, we can actually say that this Omicron has been in circulation for a while now, and not just today. But because it takes a while before the screening of these samples are done, it may take a while before they're able to get the sequence of these particular variants. So I think that may actually be the issue why they were able to detect these variants among our population before now.
All right, so what you're telling us is that the journalists knew, and now what the government is saying vindicates their reports from October. The question now becomes, how did the journalists know that there was this variant that was circulating?
Okay, so yes, when they suspected a new variant that was actually different from the normal COVID-19 variant, and then the Delta variant, they went ahead and started their sequencing. And because the Omicron variant is like new variant, so a lot of some of these local media has already admitted that that will actually be Omicron. I know one thing that with COVID, if you followed up through with some of the news we've had during this the pandemic, lockdown and all, is that trusted media channels don't want to declare, and even all the Center for Disease Control's organizations don't want to just come out and declare directly that this thing is happening. Okay, this is the drug, this is how you should do it. So the Center for Disease Control in Nigeria was actually waiting and then hoping that they are able to confirm thoroughly, like be very sure of the screening they are doing on the samples before they declare. I think that's actually what happened. But when they come today, they said the samples that they got last month where they detected the new variant was actually Delta, and that was actually Omicron. Now the new variant that they got to be Omicron this time around, which they declared today, was actually samples that they got from new people that came into the country like a few days ago, not like last month.
All right. I mean, the news story we understand and the timing makes sense. South Africans traveling. But again, I want to go back to how the journalists knew that there was a new variant. It could only mean that it had already been sequenced by somebody who was capable of sequencing and shared that information with them.
Well, I want the only legalized and the only approved agency to do that in Nigeria is Nigerian Centre for Disease Control. I think there was a post on Washington Post. There were posts all around that was suggesting that this was actually Omicron. In fact, some of them were not even suggesting; they were claiming that those cases then were actually Omicron. But I think for me, because I've worked with my organization has worked with Centre for Disease Control in Nigeria very well, most times they want to be very sure. But the problem now is, what if this has been in circulation for a while? So a lot of people might have contacted this and be spreading it even before they detect today. So that's actually the issue. But yes, what you said may be true. We have some laboratories that might have detected and communicated to journalists. But the official agency declared it today, and officially, I'll be honest with you, today is the first day we have Omicron cases in Nigeria. So whatever might have happened before now, because it's not coming from the Nigerian Centre for Disease Control, NCDC, they won't be considered. So I know a lot of consequences may come from that, but yes, they have to just do what they have to do before they come out to say what they have to say.
Have you seen an increase in the rate of infections? Because this variant, it appears to be quite virulent and highly transmissible. We're seeing quite a surge here in South Africa. Are you seeing a similar pattern in Nigeria?
Okay, so for the Omicron, so we are still awaiting the declaration of the Director General of NCDC in the next 20 minutes. Will be coming on live TV to give us latest on Omicron. So that's actually when we know the latest about Omicron in Nigeria. But for now, it's just those 2 cases. In fact, the funniest thing now is that there's some media outlets that are saying the cases that Nigerian Centre for Disease Control detected today are not just 2 cases, that they're actually 3 cases. There are some they will come out down, they will say 2 cases. There are some who say 3 cases. So we want to hear from the Director General, Dr. Ifedayo Adefila, by 9:30 Nigerian time today. That's when he will declare everything to us, and they will know if the cases they had earlier today have increased or still remain like they had in the morning. So there are a lot of developments are happening really. And then I think I heard that Ghana too have discovered their first case of Omicron already. So a lot of things are happening. The new development really is a new development. Isolation centers are opening up again, and a whole lot of things are happening in terms of response. Government considering because of the 4th wave that is happening, because this will actually be the 4th wave in Nigeria. Because of that, they want to probably put some regulations to movement. So a lot of things are happening at the same time. Fear, but because the whole thing will be declared in the next few minutes. So that's when we now know, and then even the government will know the next steps to take.
How is testing going in Nigeria? We've always been quite surprised that the most populous country on the continent doesn't have as many COVID-19 cases as it ought to in real terms if we start looking at things statistically. It's either that you were very lucky or that there's a significant undertesting that's taking place.
Okay, so as much as everyone that presented themselves to be tested in Nigeria have been tested, a lot of people have been tested, but attitude of people are not going out to be tested. Lots of yeah, we may have a lot of unreported cases, yes, but the attitude and behavior of people actually stems from what the government has been doing over the years. A lot of people have lost interest in whatever the government is saying, and people think this is actually a government agenda. And then because of the lack of exposure for some of the population, in rural areas, think maybe you want to infect them with something if they are getting tested. So yes, we can understand that a lot of things are happening that may not be detected by the Nigerian Centre for Disease Control. But I must tell you that as much as possible, our Centre for Disease Control has been wonderful over the last few months, because even for the COVID-19 pandemic took them from where nobody even knew that we even have a Centre for Disease Control, and they were able to create more laboratories across the country, from 1 to 2 to 3, and then we have a lot of laboratories across the country. The areas where they can't get public laboratories to serve the population, a lot of private laboratories were set in motion to be able to do the same laboratory testing that the public laboratories can do. So yes, government are doing what they can do. The Centre for Disease Control are doing what they can do. But it depends on what people are if people are presenting themselves to be tested. So as everybody that has presented themselves to be tested have been tested. So yes, I agree with you that there may be a lot of unreported cases, but I don't think the Centre for Disease Control can do anything about that. It stems from what the government have been doing about the world.
How well is Nigeria doing in terms of vaccination? And I suppose there probably will be greater urgency now that the Omicron variant has been detected.
Yes, that's actually very true. So a lot of people are now getting vaccinated. Since the time the Delta variant was discovered, a lot of people are presenting their family members, their aged people, their older population to be tested. A lot of people who have underlying symptoms to be vaccinated, with COVID-19 vaccine, because they are able to now see that these COVID-19 can actually go from just one variant to 2 variants, and then you don't even know what's coming next. So because of that, a lot of people are having change of mind. I don't want to get the vaccine. Okay, let me just get the vaccine. Okay, I won't get the vaccine, but my parents will get the vaccine. So lots of things are happening very fast from people. People are changing their mind, and then because of this Omicron too, because of how deadly these new variants can also be, a lot of people are now presenting themselves to be vaccinated, but still, a lot of vaccines are not yet collected at the primary health care center channels across the country.
Gabriel Oke, we're going to leave it there. Thank you very, very much indeed for joining us on the program and giving us an update from Abuja. Thank you.
Thank you.
All right, that's Gabriel Oke, who's a health journalist in Nigeria, speaking to us about the Omicron variant. And it seems as if journalists were reporting about this new variant as far back as October. The authorities were still testing to see if that was the case, but today retrospectively admitting that perhaps that the virus had been there earlier than it was detected here in South Africa. So perhaps it might throw out different equations in terms of where this new variant may have first emerged.